Hi, Alex Watson, Orthopaedic Consultancy, Clinical Director. Let's talk knee injuries. So base anatomy is you've got the medial collateral ligament here, the lateral collateral ligament. They stop buckling, forces happen to the knee. So classic football injury, you twist it and you strain this ligament here, or you get buckled the other way and you strain this ligament here, and it's a buckling force that occurs. Then you have your inside here, this blue thing, that's the meniscus, and that keeps two uneven shaped sized bones congruous, basically line them up. And what they do, it allows that movement to occur. And you can see as you move it, there's different sections of this blue thing that are under pressure at different movements. Often what happens is that if your knee's been flexed for a long period of time, that puts pressure on the meniscus. What we want is that knee upright and distributing the weight across the whole meniscus to take the pressure off it. You also have kneecap problems, so your patella. The back of the patella needs to go up and down this sulcus and actually needs to track more medially through this ridge going here. If it goes laterally over this ridge here, it hits and causes wear at the back and soreness. You get some swelling behind the knee. Then the catastrophic injuries are these ligaments in here, the PCL and ACL, the posterior cruciate ligament and the anterior cruciate ligament. And those two ligaments are to stop the shearing forces going backwards and forwards. If you do rupture this ligament here, the ACL, that's really serious, and most of the time we'll need surgery. Otherwise, it causes quite a lot of instability in the knee. So you can see there's quite a lot of things that are structures that can go wrong in the knee, and because it's got normal cartilage and an extra bit of cartilage, it means it's a quite complex joint with extra twisting motions, etc. So if any of those structures are not working very well, it puts a lot more pressure on the others because it needs adaptability. So if you've got injuries, often one injury will then lead to another. So if you don't sort out the first injury, then another injury occurs, and then suddenly you're in a situation where you then need surgery because the structures have been damaged so many times that you get into trouble. I've seen a guy this week like that. So those are the basic types of mechanical problems that you can get in the knee. But there's also some general ones. You can get the quadricep starts to get tight and pulling on the knee, and that's the start of a problem in the kneecap. And that often means if you get some tightness, the kneecap starts to then rub incorrectly. So just loosening up the front of the quad will just loosen up the kneecap, and it comes less bound down and rubs a lot less on the front of that knee. Classic thing is that people kind of think, oh, I've got a really bad knee problem, and they get pain at the back of the knee, just on the inside of the knee, the side and the inside of the knee here. And actually that's a hamstring insertion problem. Now the hamstring can get in trouble for lots of different types of injuries. But it can be just you're tight, you're sitting behind a desk, and that tightness causes issues. So you can see those types of problems then lead your knee to get into trouble. And then if it's not moving right and the muscles aren't right, then those other major structures, if you put some more pressure onto it, can then cause you a lot of problems. I hope you find that interesting. If anyone's got knee problems, you can start with some basic exercises of stretching the quadriceps and the hamstrings, or just sort of loosen it off generally. And those exercises can be very useful to take the pressure off, but it doesn't explain why the knee's overworking. So that's where we come in really well, is to actually treat the symptoms locally, but understand why the treatment is needed and why is the problem there. Not what the problem is, it's why is it there, and then we understand the what. I hope that's useful for you guys, and we'll see you in the clinic when you need us. Take care, guys. Bye-bye.